perform trigger point techniques for the posterior hip, firstly we have the most superficial muscle, the gluteus maximus, travelling obliquely. The top part of that muscle inserts directly into the ITB, with the lower portion inserting directly into the gluteal tuberosity. Deep to the gluteus maximus, we have the deep six. To treat the deep external hip rotators, we can bring the patient's hip into a slight amount of abduction, bring the knee into flexion, and we're sinking in through that gluteus maximus. Now, identifying the direction of the piriformis, the gemellus, the obturators, gemellus inferior, obturator internus, and then the quadratus femoris most inferiorly. So they're slightly directed in a medial fashion. So from the greater trochanter, we're sinking in with our elbow, heading towards the sacrum, looking for any local sites of tenderness or recreation of the patient's posterior hip pain. From this position, we can then take the patient into hip internal rotation, which will be a pin and stretch technique. By sinking in, pinning that muscle and then moving them into internal rotation, it's creating a stretch through those deep external hip rotators. As we move most distally, the quadratus femoris, we can identify the ischial tuberosity and the gluteal tuberosity. Right in between here, we can find the quadratus femoris muscle. And in the same fashion, sinking in, slightly directing our elbow in a more medial direction, and then moving into hip internal rotation.